All right. So for the next thing which we'll actually be looking at, this is what is genetic amniocentesis. All right. So amniocentesis, like we earlier on spoke about it, is just a test that you basically what you are using ultrasound to guide you. You put what the syringe, then you pick up, some samples of amniotic fluid, So genetic amniocentesis is just a prenatal diagnostic procedure. It's used to dictate chromosomal abnormalities and genetic conditions in a baby that is developing, So it's typically offered where there's an increased risk of genetic disorders based on screening results, family history, maternal age. So what happens during the whole procedure is it's performed between week 15 and 20, So a thin needle is usually inserted, through the abdomen into the uterus. This is under ultrasound guidance. So a small sample of amniotic fluid, which usually contains fetal cells, is drawn. Alright? So the fluid is sent to the lab for chromosome analysis, DNA testing, and sometimes alpha fetoprotein levels, because you want to check for neural tube defects. Okay. So what it can dictate is this: genetic amniocentesis can identify chromosomal conditions like all those Down syndrome, Edwards syndrome, Fetal syndrome, Turner syndrome, Fetal syndrome. Can pick up genetic diseases like cystic fibrosis, Tay-Sachs disease, Duchenne muscular dystrophy, sickle cell disease, also neural tube defects, sex-linked disorders, and microdeletions. So risks and consideration is sometimes it can cause miscarriage, sometimes cramping and spotting, infections of fluid leakage, alright, sometimes resus sensitization.